Hello, family. This is Kelly Calabrese, and we're here with your science tip of the week. And today we have the pleasure of having Dr. Rocky Bigbie with us. And Rocky, welcome. We're so thankful you're here.
Thank you. I've done worse things in the morning.
Well, you are the veterinary liaison for Renovo. So first, tell us what that even is. What is it that you do for Renovo?
Okay, Kelly, I've worked for over 2 decades in the animal pharmaceutical industry. I worked for the largest animal health company at one time, and I retired a few years ago, and I was sitting out on my porch reading about Renovo, and I thought, gosh, that's right down my alley. I had done things with amnion back many, many years ago. During my residency, I did some research just using placenta, the fetal portion of the placenta, the amnion, on wounds. And of course, that's the active ingredient there in Renovo. So I thought, gosh, this is very interesting to me. So I recruited myself to the company. I contacted them and told them I thought that, I might have some knowledge and skills that might be useful to the company. The reason that I thought that is because in all those years working in the animal health industry, I know so many people at the universities, in practice. I'm sort of a obnoxious type of gregarious human being, and so I forced myself on people over the years, and I thought perhaps some of them might remember me. The inventor of the product and our chief scientific officer, Christian, who's been on here before, he is from Canada, and I know that he doesn't know as many people in the equine world as I do. So I think it's a good marriage. I'm able to be a gatekeeper for them and maybe point them in the right direction occasionally.
Well,
and plus, I've had this long passion for amnion, and in the back of my mind, even when it was long gone from my daily existence, I always thought, gosh, somebody should do something with amnion. It has such remarkable healing capacity. And there was a time even when I thought I might do something with it, but I really, and I'm not joking about this, this is not feigned humility here. I really wasn't smart enough. I didn't really know how to take amnion and bring it to the marketplace. So when Renovo came along, I thought, there's my guy.
Wow.
So that's how I got involved. And liaison with the equine veterinary world is a good role for me.
Well, we are glad that you are in it and that veterinarians have the opportunity to talk to you, because no one's better than you to answer their questions with all of your years experience, decades in veterinary science, in research, and with amnion. So we want to invite our vets to be able to connect with you if they have any specific questions. So the human research has been going on for a long time. What are some of the highlights there on the human side that maybe you can share?
Well, it actually is. It was almost unbelievable to me when I realized that amnion had worked its way into the equine world. I started reading some of the human literature, and of course, I hadn't been paying attention. And over the last decade, it has gone from very little in the human market. For 100 years, it's been used in burn victims. And then it made its way to bed sores, non-healing ulcers. And but in the last decade or so, it's grown to a huge market. I think $1.5 billion, maybe, or over $1 billion on the human market, basically displacing much of the regenerative medicines that have been used there for a long time. And I guess it was just such a shock to me. I hadn't been paying attention here. I'd had this great enthusiasm for amnion all these years, but I did not know what was going on the human side. And it is quite amazing. Athletes, all sorts of sports injuries. I mean, very, very severe injuries. That amnion, you think about it, it's protecting the fetus. And there are two sides of the placenta. The maternal side obviously comes from the mother, the dam, and the fetal side is from the fetus, the embryo and the fetus. And that amnion protects the fetus from rejection by the mother, and the growth, the development, the natural healing of that fetus is derived from the powers of the amniotic fluid and the amnion. They're both in Renovo. So on the human side, if there is a need healing, regardless really of what the tissues, skin, cartilage, tendon, it's being used. You name it, amnion is being used to heal those tissues. And the amnion in Renovo, there is amniotic membrane that's micronized. It's very small, too small to see with the naked eye. And it's suspended in the amniotic fluid. And in there are growth factors, cytokines, things that can take a wound from a static condition where it has, in layman's terms, the wound has given up. This happened, horse owners have seen this. A horse has such a tremendous healing capacity, but sometimes the wound just stops. And the wound could be the skin, it could be a tendon, it could be a ligament, and there's just no healing taking place. That fetal amnion goes in there and resuscitates the wound healing process. They've known this for a long time on the human side. We're really getting rolling on the equine side, introducing it around the country.
Well, that is exciting, and thank you for explaining that. I have just two more questions for you. One of them is about the frozen. So the Renovo comes frozen to the vets, and so this is different from some of the other products that they may be receiving. Can you talk about the frozen aspect and why that's actually an advantage?
Yeah, the initial thought process, some of my friends say, well, I don't handle any frozen products. I'm in my truck, I'm going out. That's a big disadvantage for me. But actually, it's one of the great features. It's one of the great features of Renovo, because that process of freezing the product, shipping it frozen, storing it frozen, and then only thawing and drawing right before you use it, that preserves those cytokines, growth factors, the proteins in there that signal to the body to start over with this wound healing process. Go back, resuscitate that remarkable capacity for healing, and gets it going again. Christian is a really smart guy. And he came from the human side. Don't tell him I said that. He came from the human side where he had worked with human amnion for many years. And even in independent studies at even some vet schools, the human amnion products have been analyzed, and those that are prepared, lyophilized, they're put on the shelf, they are taken through a long process to get them at room temperature so they don't have to be frozen, have been shown to not have any active proteins at all. It would be nice if that were the case, if you could just set it on the shelf, room temperature, draw it up and use it. But Christian knew long before he developed Renovo, that was not the case, that it did need to remain frozen. And the frozen product is actually a great advantage, because that is what makes Renovo so effective when that wounded tissue needs that signal.
That makes perfect sense. So my last question is, you mentioned that there's been over 3,000 now horses that have had Renovo, and that represents hundreds of vets who have made the decision to take a look at Renovo and to give it a try. We know sometimes that change is hard. We're not saying veterinarians are stubborn people at all. Just, we are saying that, sometimes it takes effort to look at something new. And so if you were to speak to a vet right now about Renovo, being someone who was in the trenches and being there yourself and caring about, all your patients, what would you say to them about taking a look at Renovo?
Well, a good equine practitioner looking at a new product, the first thought is first do no harm. And so we all have the safety of our patients in mind. We also have the respect and trust of the horse owner or the trainer in mind. And so there's never been a stubborn veterinarian.
Nope.
Certainly. But we are somewhat resistant to change, because we have used a product in the past for the first time. We've established that it's safe for the patient. We've told the horse owner about why we're using that product, why we have confidence in it. We have used it over the years to establish their trust in us, comfort with the product going into their horses. And now we have something new. We have to do that over again. We have to, establish, build up our own trust in the safety of the product, the efficacy of the product. We have to embark on this new effort with the horse owner to convince them, well, wait, I've never heard of Renovo. You're going to put what in my horse? And so we have to reestablish that trust with them. So it's not a stubbornness. It's not just a blind reluctance to change. There's a lot that goes into that. First, do no harm, safety, confidence in the efficacy of the product. And I would just say to them, the safety of this product is well established. It's been used in approximately 3,000 horses now. I'm leaving today to go see a safety study that we've launched, just for that reason, that people want to know that this product is safe. So I'm going up to the Center of All Knowledge and Learning, Oklahoma State University, again today to just observe that. I won't say I will help, because I would be in the way. But we've got ample evidence, research to show that it's safe, it's efficacious, and so the product works. So that's two of the issues there that make veterinarians so reluctant to change, is just knowing that the product is safe and effective.
Excellent. Well, that is a fantastic answer. And for anyone who would like to see some of the research or get more information, renovoequine.com is our website. All of our contact information is there, and they can see some of the white papers and research that has been completed there. So we definitely invite them to do that. Rocky, how can people get in touch with you if vets have any specific questions? Should they just message you through Facebook? Is that the best way?
Oh, probably the best way is my email. It's rocky.bigbie@amniosolutions.com.
Okay, and I'll post that in the comments too. Well, thank you so much. We appreciate you taking time today on your way out to the university to do some more great work. So we appreciate you. Thank you again. And if anyone has any questions or comments, please put them in the feed there. We will go back and we will check on them, and we'll make sure that we get your questions answered. Have a great day. Thank you, Dr. Bigbie.
Thank you very much, Kelly.